Hi, everyone, and welcome to Out of the Gray, a podcast by Standard Imaging. If you haven't already, please subscribe to the podcast, leave a like, and share with your friends, family, and colleagues to help these messages continue their reach. Without any further delay, let's jump into this latest conversation. Hello, and welcome to another episode of Out of the Gray, the podcast where we discuss all things radiation oncology and medical physics. Today, super special guest, Angela Oliveira, Program Director and Chair of Radiologic Health Professions at Manhattan College. Angela, thank you for taking time to join me and my listeners here on Out of the Gray.
Yeah, thank you so much for the invitation.
My pleasure. I'm super excited to jump into your story. I've been following you on social media. I'm a huge fan, and we got so much to cover, so much to talk about today. But first and foremost, I'll go ahead and let you introduce yourself, if you will.
Yeah, sure. Again, thank you for having me. And it's been great connecting with you on LinkedIn. So I have been working in radiation oncology for about 14 years now and had such a meaningful career. And now I'm actually an educator where I'm teaching radiation therapy students in the academic setting. So it's been really great. It's been full circle. I'm actually an alumni from the program where I'm teaching now. So really just an awesome opportunity for me. I recently presented for a group of therapists in Florida about how they could empower their career, looking for ways to publish and conduct research. And so I was invited to present there, and I thought this would actually be helpful for our radiation therapy community because a lot of times we just don't know where to start. And so I put together this slide deck just to kind of help in any way that I can for those who are interested in the process. So this presentation is called Empowering Your Career, Navigating the Path to Professional Growth in Radiation Therapy.
Well, Angela, again, welcome to the show. Thank you so much for taking time out of your busy schedule to join us. While we get started, would you mind telling our listeners a little bit about your journey into radiation therapy?
So just to give you a little bit of information about me, I graduated in 2010 from Manhattan College with my bachelor's in science and radiation therapy. And shortly after, I began working as a staff therapist, where I worked for 7 years in a very fast-paced clinic. In about 2018, I was offered a position as assistant clinical supervisor at Mount Sinai Hospital in the city, where I managed the day-to-day practices for the physicians, and we had a group of about 20 therapists, so a pretty busy clinic. Really great opportunities there. I would say that's really where I was encouraged to start presenting and start doing research. So it was really what kind of opened the doors for me there. Really great support system. And then in 2020, I was offered a chief radiation therapist position for Northwell Health. And so we were one of the largest healthcare providers in the region. So it was really great to collaborate. We had so many different offices and we would meet regularly to go over best practices. So really great opportunity that I had working with everybody there. And throughout the years, I actually taught adjunct in Manhattan College, teaching patient care procedures to nuclear medicine students, allied health students, and radiation therapy students. So my heart was really always in higher education. And in 2022, an opportunity presented itself for me to take over the radiation therapy program as program director at Manhattan College. And so that's always something that I was always passionate about. And so here I am from 2022 to present. This is my current role. I'm also chairing our nuclear medicine department. So it's been a really great opportunity to give back to the higher education community and really mentor our students and the future of our healthcare professionals.
That's interesting. Is there any data out there that supports advancing your professional portfolio?
So when we look at presenting, publishing, writing articles, there's actually been evidence-based research that says that healthcare workers who publish, present, conduct research actually have higher satisfaction levels in the workplace. So there was a study called the Scholarly Activity and Job Satisfaction among General Internists. The study aimed to examine the relationship between scholarly activity, so things like research publications and conference presentations, and job satisfaction. And so the findings were that there was a positive correlation between engagement in scholarly activity and job satisfaction among those internists. And those who were engaged in these types of professional development opportunities had higher job satisfaction, and they were less active in academic pursuits and to actually stay where they were working in the moment. Just some interesting articles
That is interesting. Yeah.
to tie into what we're talking about today. And so, what are the benefits of presenting and publishing? Just for professional development opportunities and career advancement, it always looks good to have on your resume that you presented at a national conference or you've conducted research. And also, really important to talk about contributing to the advancement of our profession. There's been so many advancements in the last few years, and it's really up to us to do that, to contribute to the advancement of profession. Our community is so small, and so we have to, give back in that way. I think it's really important. And then, of course, opportunities for networking and collaboration. There's been so much, I would say, there's been so much networking in my life that I've gotten just from LinkedIn, attending our national conferences. So that's really important for us in our profession to do that. And then writing for publication. So for those who are interested in writing for publication, you might not know where to start. And I'm going to kind of go into that today on our talk, but the publication process, knowing where to start, how to submit, and know the different types of publications that you are going to be writing for is also important. Do you want to write for a scholarly journal, or do you want to publish in a magazine? So knowing the different types is really important. There's also writing tips. You want to make sure you're clear and concise. You're using appropriate terminology. I would say Grammarly is really great to kind of run your finished manuscript through to get that feedback, to see if there's any changes that need to be made. And then, of course, you always want to take into consideration our ethical guidelines. So ensuring that there's no plagiarism there and no conflicts of interest is important as well. So some effective presentation skills, you always want to obviously know your audience, right? Understand the demographics, the interests. I think in our profession, we all kind of share the same similar interests. And so that's something that's going to keep your audience engaged is really important. Structuring your presentation. So you want to always have clear main points and supporting details without overwhelming your slides. It's really hard for the audience to read things if the slides are filled with a lot of wording. So you want to just try to have clear and concise points. I also found that using visual aids in my presentations are helpful to keep the audience engaged during the presentation. So you want to use those as best you can. You can also engage your audience by conducting polls or surveys through the presentation itself, and so that really helps to get their attention during the presentations. I always try to handle questions at the end of the presentation, and so you always want to kind of be prepared for what the most common questions might be, so you're not thrown off guard at the end. And then I would say a really big part of it is rehearsing and giving yourself time to practice the delivery, so that you can kind of manage your timing and nerves. So if you can go into the speaker room ahead of time to just kind of feel what the room is going to be like when it's filled, is also really helpful to alleviate any stress or anxiety you might have when you're presenting.
Well, this will be really helpful for our student listeners as well as the professional listeners who are looking to get more involved in the field.
I would say for our community, you want to find something that interests you, or that you're passionate about, because you're going to spend a lot of time researching this topic. So if it's something that's not really something you find yourself interested in, it's going to be difficult to do that. So, and then also find something that will interest other professionals alike. The first time I presented at the ASRT conference was in 2019. And my topic was managing staff burnout and its effect on patient safety. And I think that's something that a lot of radiation therapists or any healthcare professionals can really relate to, right? Yes. At some point, we've all felt that burnout, or, we feel like we're just moving forward with the day, and it just seems like there's just no advancement and you're just kind of stuck in that same day to day. Yeah. So that inspired me to do research. And it was so interesting because when I was doing my research on this, I learned that 42% of radiation therapy professionals felt a sense of diminished personal accomplishment in their profession. Which is really interesting when you think of our patient population. We have such an impact on our patients during their cancer journey. So for 42%, almost half of our community feeling like they lost that personal accomplishment that was an eye opener. And 30% of radiation therapists had some sort of emotional exhaustion.
Mm-hmm.
Clearly, we were doing something wrong, right? Like, what can we do to improve our sense of well-being while taking care of our patients? So that was something that really, really interested me. And so we explored other ways, other avenues to just feel better. A lot of therapists, in doing my research, said that having a manageable workload, a sense of autonomy, just feeling like they have some sort of recognition for their work and support was really the key factors that contributed to staff burnout. And so we looked at ways that we could improve that. So having some downtime, having weekly meetings with our team to get their input on things that we're doing in the healthcare setting, and see how we were doing, because then it relates back to a high employee turnover, which costs the facilities money. Every time they have to go through the interview process and hiring process again. And so that was something that was interesting to me. We discovered that 84% of reportable treatment deviations was between 2002 and 2009, that the therapist played a role in that, tying back to patient safety. So that was really interesting. And I felt that after I presented on this, I was able to connect with so many professionals in the country. I would have several therapists reaching out to me saying, that this one tactic that they added into their day-to-day really made a difference for their team. It's really important because then you feel that you're presenting or publishing that you are able to give back and help other therapists in the field.
That's amazing that you were able to make it a direct impact and then see that impact come right back as people are reaching out and offering their advice on what works for them. And this is such an important topic because, I've spoken about it a few times here on Out of the Gray about radiation therapists are such a unique and precious group of people that to see the attrition, the leave rates based on topics like this alone, it's really disheartening. I'm so grateful that there's folks like yourself out there and the individuals brave enough to come forward with advice, battling this very big problem.
Yeah. And I would say, too, when you keep your staff happy, then your patients are going to be happy, right?
Oh yeah.
So it was really important. It was a really important topic for me, and I think it did make a really positive impact on therapists across the country. So this was kind of my first time, and I never really presented in such a large capacity, so it was a little bit of it did
Unnerving.
cause a little bit, yeah, exactly. But once you do it once, then you're like, okay, I got through this, so this was my first time, and it went really well. The feedback was really, really positive. And then, so this led from small steps to great leaps, building success step by step. After I presented, I started kind of looking into publishing, and I knew I wanted to start small because I was overwhelmed with conducting like research in a scholarly based article or journal. And I thought about Scanner. I said, this is a really great magazine for our medical imaging community. And I had some really great ideas that I wanted to share with the community. So the first one that I had published was called Crisis Leadership, and it was during the pandemic. It really explored different ways to kind of keep your team engaged, involved in patient care during a really scary time when healthcare professionals were working in the pandemic and, we couldn't stay home. So this was something that really meant a lot for me. And I actually received feedback from several managers saying, I actually added this to our routine and our team feels better.
Thanks for that. When you were working at Northwell, can you tell me a little bit more about your article, Moving Forward with a Bang?
When I was working at Northwell, we actually would celebrate a patient's last day of treatment with a gong. So the patients would come and they would hit the gong. I'm sure a lot of different centers do something similar to this for a celebratory experience for the patients. And so just talked about how, on the patient's last day, how we're all coming together as a department. Our physicians were coming, therapists, dosimetry. It was really great. So just other ideas that you can incorporate to really improve the patient experience, what's meaningful for them. So I would say if you're looking at publishing, this was a really easy way to kind of like get out there and try to just start doing little things to then maybe do bigger things.
Absolutely. I love Scanner Magazine. It's awesome resource for us readers, but then also for folks who want to get into publishing. Fabulous first steps.
Exactly. And so then, my journey through COVID as a radiation therapist, during the time of COVID, we knew that the hospital was where no one wanted to be, right? Because of the fear of the unknowns.
Well, I know that the pandemic certainly affected all of us in healthcare. Is it possible for you to share a little bit more about your journey as a healthcare professional during those trying times?
So unfortunately, our patients were isolated. They weren't allowed to bring visitors with them or family members to feel supported. And so that increased their anxieties, just that feeling of alone. And communication was lacking, right? We were wearing so much PPE because we didn't know what was going on. And so it was really hard, especially for patients who might have been hard of hearing. We had a patient who had come into the clinic and she was deaf, and she relied on to actually visually see our mouth in order to communicate. It was hard. So this actually prompted an idea for me. So I had gone and ordered clear masks so that the patient could see our mouth and feel comfortable that we are able to communicate with her, even if we have to be in all this PPE. So this actually prompted an idea, and I thought there has to be a way that we can better facilitate the communication process with our patients. What could we do to make them feel at ease during the treatment process and feel less anxious? And so I decided to submit an abstract called Improving Patient Communications and Interactions in Radiation Therapy for the ASRT conference. So,
Wow.
you have an idea and you'll submit your abstract. Once you're accepted, that's when all the work begins, right? The research. That's where I learned a lot actually on this topic. There hadn't been so much research in the United States specifically, but a lot in European countries where it actually explored when patients actually had better treatment outcomes and less pain when they felt that the communication was better between the healthcare provider and the patient. So this was actually something that was really interesting for me to see. And so they actually looked at head and neck cancers and just being able to actually, because obviously head and neck cancers is one of the most anxiety driven treatments for our patients. They're in a mask, right? And we're outside the
Right.
room. And this was something that was really interesting to see, that we were able to actually reduce anxieties by preparing them ahead of time with educational in-services of what they're going to experience and what we could do to alleviate those anxieties for them. And then I would say connecting with others. So LinkedIn, again, is a great tool to connect with others. Attending the conferences have been really instrumental, I would say, in being able to just connect with other program directors or other radiation therapists in the field on how we can do things better for our patients, right? So just because at the
Absolutely.
end of the day, that's what matters most. So submitting an abstract, the ASRT does a really great job going through the steps to submit an abstract.
Submitting an abstract can be really intimidating for those who are unfamiliar with the process. Can you share a little bit about how you get started with that process?
So they're looking for a 100 to 200 word description of what your presentation is on. And then you have to outline about 3 to 5 course learning objectives. You'll also submit a copy of your resume along with a professional headshot. And you'll also want to submit a speaker biography. And then they also provide an example of what they're looking for. So it kind of outlines the description and the objectives, and then what the outline is going to look like. So this is actually really what kind of helped me with just even starting the PowerPoint for my presentation, because once you outline it and you have all of your different areas that you're going to talk about, it just makes it so much easier to actually sit down then and figure out where you're starting first.
Do you recommend any specific topics or maybe some ideas that might be more likely to get accepted by the review boards for publication?
So some topic ideas for the radiation therapy conference. These are just some that I had pulled off the ASRT website. But if your site has a way to improve workflow, that's something that can help all different radiation oncology clinics, right? Whether it's a faster way to, get our prostate patients prepped and ready to go and not have any hiccups on the machine, right?
Right.
um, or you just have something that can help with DIBH techniques. So anything that you think could improve workflow for other departments is really helpful. Career pathways and insights. So there's so much talk about this now, right? Where
Mhm.
can we go with our profession, with our degree, if we're looking to kind of move in a different direction, another avenue? Patient care, safety, mobilization methods. So these are just some that, you can find this on the ASRT website if you kind of aren't sure about an idea that you're interested in presenting on, which I thought was actually really helpful too.
Thank you for sharing your presentation with us. And I know you've turned your presentation into a publication. Any recommendations on that process? Maybe some steps or some tips on how to transition from presentation to publication smoothly?
So after I presented on improving patient communication in radiation therapy, I thought, okay, I have all of this pretty much already laid out. So how can I publish this in a scholarly journal? And so the ASRT has a really great resource to show you exactly how to do that. So this was so basically I turned my presentation into a manuscript, and it was published in the spring of 2023 Radiation Therapist Journal. It's just such a great feeling to actually see the work that you're doing on paper, which really meant something to me as a radiation therapy professional.
Thank you so much for that. Definitely sound advice. If our listeners are still not really sure where to start, would you have any tips, tricks, or maybe some recommendations on how to initiate that process and where to start?
So, turning your presentation into an article, some of the steps are recognizing the main points. So, you want to always have a purpose statement that will summarize the main topics of your presentation. And then you'll also fill in the blanks along the way. So, you want to follow your outline and write the article. And they're really supportive on taking a look at your manuscript and then providing feedback, and then you have to go back and make those adjustments. So most of the times you're going to be editing your manuscript a few times before it actually gets accepted for publication. And then, of course, you want to have your sources or your references be no more than 10 years old, so more relevant. And then you'll submit it, and you'll wait to hear back to get the feedback from the SRT. And like I said, you might have to submit it again a few times, but the end result, it being published, is a really rewarding feeling.
And there seems to be a lot of ways to get involved and a lot of opportunities to really participate in the advancement of our profession. Could you talk to us a little bit about any other ideas you might have on how to get more involved?
So, if you're not sure where to start, there's also a lot of information on the author guide. You could publish in the ASRT Scanner magazine. Like I mentioned, that was something that I started with because it wasn't a scholarly piece that required much research. And so that's published 6 times a year. And then you also have the radiologic technology and radiation therapist journals. Those are published. The radiologic technology is published 6 times a year, and it serves 157,000 radiologic science professionals. Radiation therapist scholarly journal will serve about 16,000 radiation therapists and medical dosimetrists, and it's published twice a year. So this kind of just lays the groundwork of where you can begin. There's also different manuscript types you can look into. So you have your short report. So this is going to not require any peer review. You also have original research, which is going to be a peer-reviewed article. that will explore an area of interest through systematic investigation to expand knowledge within a particular field. And then you have a systematic review, which is also going to be a peer-reviewed article as well. So you have different areas that you can go down. And then, so enhancing the radiation therapy community, I would say that there's always an idea that could be used to help our community, whether it be a guide, a publication, research, a presentation. I actually recently published a radiation therapy pocket guide for student reference for students that are in the field, which includes definitions and medical abbreviations. And this idea popped into my head one day, and then in a few months, it was created, and it was so awesome to see it in my hand. I have it here. And
awesome.
so I've gotten such great feedback on it and just ways that we can improve. I mean, I remember as a student myself walking into clinic on the first day and hearing terms, and I was like, oh my gosh, I don't remember what that is. I know we learned it, but I don't remember what that means. And maybe you feel nervous, or there's just not time in that moment for the therapist to explain and go into depth. So this was an idea that I had, and it's been so well received so far. So I'm super excited to be able to give that back to our students.
That's amazing. I wish I would have had one when I was in school. That would have been incredibly helpful.
I agree. I mean, there's so many things that we are able to offer our student population now that I think back and I'm like, oh my gosh, we only had this
I
when
know.
we were in
Ugh,
school. So
I love
so
it.
it's really great. It's really great. And so other ways that you can get involved, it's, if you're not into presenting or you're not into doing research and publishing, there are so many other ways you can get involved in our profession. There's a lot of volunteer opportunities, especially for the ASRT. On the ASRT website, they have a volunteer roadmap, which will include different positions that they're looking for volunteers. So I currently sit on the Scanner Editorial Advisory panel. And so we review Scanner articles and things like that, but that's not all that you can volunteer for. So you have, again, the Scanner Editorial Advisory panel. There's a student mentor program you can get involved in, where you'll be mentoring a student throughout their clinical education. There's committees, state affiliate leadership, annual governance and House of Delegates, and task force and work groups. So there's so many different opportunities out there that you can get involved if you just are looking for something else within your day-to-day to participate in. So some key takeaways: presenting and publishing are vital components of our professional development for radiation therapists. These are really what is going to contribute to the advancement of our profession and then allow therapists to share their expertise within the broader healthcare community. Again, so many different clinics have great ways to improve setups, maybe decrease time for the patient to be on the table. And so why not be able to share that with the community so that we can improve the patient experience? And then, of course, it's really important that you understand the publication process and, of course, are always adhering to ethical guidelines and really engaging and presenting, publishing, and network opportunities to elevate our profession and promote awareness, because not enough people know what we do, right?
That's
And
true.
we have a very important role. So I would say anyone really interested in learning about the publication or research or presenting process, go on the ASRT website. That's really what helped me and what started my journey into presenting and publishing. And so just to end this, through research, publication, networking, and presenting, radiation therapists forge pathways of innovation and excellence, enriching our collective knowledge and advancing the standards of care for those we serve. And then I'm going to also include my LinkedIn handle for anyone out there that has questions.
Thank you so much for sharing that. I am so honored that that you're willing and able to come and join me and share these things. As I'll ask a couple of questions on your presentation. So first out, I apologize for having to step off screen. I've been sneezing. So for those watching, I didn't want to just sneeze in everybody's faces. So forgive me there. But during one of my sneezing fits, you were talking about the outcomes of patient treatment with increased communication and how patients are seeing improvements in outcomes is can you tell us more about this? This is something I think we've all known deep inside for a long time, but I'm so excited to see scientific research coming about kind of proving that point.
Yeah, sure. I think back to times where in certain clinics I was working, and on the patient's first day, we would just bring them in the room and we would just kind of put them on the table and tell them in the moment what we're going to be doing.
Mhm.
But there's been evidence-based research that if you actually dedicate a time to set a patient aside in maybe like a consult room, just one-on-one, where you're sitting down with the patient while they're still in their regular clothes and they're not feeling like they are
Yeah,
that
vulnerable.
they yeah, exactly, that they
Mhm.
just feel more comfortable. So what we actually had implemented was a pre-treatment and pre-simulation visit. I don't want to call it a visit, but it was just time that we put into our schedule to have one therapist go and bring the patient into a consult room where we explained exactly what we were going to be doing that day, so that there really weren't any surprises. And actually, that helped us to improve our care for them, because we learned if maybe they had dentures or maybe they had shoulder limitations, and we were going to have to kind of rethink how we were going to simulate them.
Mhm.
So it not only just helped to alleviate the patient's anxieties, but it also helped us determining the best possible setup and position for the patients during treatment, which actually helped us to um, complete our tasks in a more efficient way.
Oh, I think that's brilliant. I think that's super insightful, especially for folks who are, it's scary. Radiation is scary from a patient's perspective. It's terrifying for some, and having that time to just be your normal self and ask questions and learn. Because I know, when I'm interacting with patients myself, they get that diagnosis and everything kind of glasses over, and nothing is going to be heard for the duration of the first talk with the physician. So having them come back is, oh, that's such a caring thing to do, to provide that opportunity for them to reflect at home and then come back with questions without any pressure to perform some type of task for the clinic, for their treatment plan, right? That's
And
so
I would say
insightful.
too, sometimes they're actually scared to inform their physicians on things. And
Oh
when they
yeah.
come back, they actually tell us about it. So, having that separate time without just bringing the patient into the treatment room or to the CT really made a big difference for us.
That's amazing. And so a large part of our audience too is medical physics professionals. And I'm curious, have they been involved in this process in your experience? Because personally, when I would have a medical physicist come in and chat with the patient, that too, I saw like a moment of enlightenment where there was just this calm that came over a patient where they felt even more supported and educated, and were able to make improvements kind of in their positioning every day. So what are your thoughts on that?
Yeah, so in my experience, anytime that I involved the physics team was when we would have some sort of question on the patient's setup or limitations, right? So
Hmm.
maybe we have a lung case that we're simming and the patient can't bring up their arms. And so I would bring in the physics team to come in and kind of see what we could do and work
Hmm.
collaboratively. I think when a patient sees that, when they see more members of the and the multidisciplinary team involved in their care, they feel much more comfortable, because
Yeah.
they then feel like, okay, wow, I have a therapist, I have a physician, I have a physicist
Yeah.
involved in my treatment plan. So I think the more hands you can get on deck, the better outcomes the patients are going to feel in that moment. And then actually, we also included our dosimetry and physics team on the last day of the patient's treatment, where they would come over and do the celebration with us. So they would be able to see like the behind the scenes folks who worked on their treatment plan. So that was something that I think also was meaningful for the patient.
Absolutely. Something so small, right? But they're going through these very traumatic, some of the darkest days maybe they've experienced. And then they come to the end, and there's a ceremony, and to see all the faces and all the support and all the love they have, that's really impactful. That, you have patients come back years later and talk about, what a moving moment that was for them.
For sure, for sure. And I
Yeah.
think for our teams as well, like being in leadership roles in my career,
Mhm.
just recognizing what areas that your team needs support in, right?
Mhm.
Having a manageable workload. Are you giving enough time on the machine for a realistic amount of time
Yeah.
for patients to get treated appropriately? Giving them their sense of autonomy, letting them manage the schedule. And then recognition and support was so important because a lot of times our work goes unnoticed, unfortunately. And that's really what led to burnout, I would
Yeah.
say. Just that constant on the machine every 15 minutes with your patient and not having that time to decompress. So finding time, whether it's on a monthly basis or however you can kind of incorporate it into your schedule in the clinic, I think really, really makes a big difference
Mhm.
for your team, to feel like, okay, my leaders care about my well-being on top of our patients. And I think that's really important as well.
Oh, it certainly is. It certainly is. The act of caring for patients, as we know, is, man, it really is a heavy. It's an emotionally I guess I don't want to. It's not a burden, but it is a challenge. And having those emotions, those roller coasters every day, and the lack of support, if it's felt, is so unfortunate. And yeah, it leads directly to burnout. There's not really. And then once that line is met, it's hard to recover from. Unfortunately, so seeing it and putting up the stop breaks ahead of that is really important to making sure that we keep our valuable members of the field treating.
For sure. I mean,
Yeah.
there's nothing more valuable than having a seasoned therapist, right, working in
Hmm.
your facility for 20 years. I mean,
Right.
and just having that sense of community is really important because
Yes.
when patients come in for their treatment, if they feel that the vibe is off between the healthcare team, then it's always noticed, right?
Yeah, it is.
So having that sense of teamwork, that sense of community, and how to keep that going, I think is really important.
No, that's a beautiful thing. It truly is. And then moving a little bit forward into your leap from clinical radiation therapy to including research into your the daily part of your career path and what you were choosing to do. Um, so for my own path forward, I went directly to the folks who were already doing research, the physics team, and I
Mhm.
said, "What can I do? How can I help?" And that was my like first steps into kind of doing. What did your first steps look like? What door did you open first? How'd you get there?
Yes. So, not every institution that you work at is going to be supportive of moving forward with research and presenting. And
Right. Yeah.
I was so fortunate to have a really great leader
Mhm.
who really kind of supported me through the process even when I was scared to do that, but really having a support system
Mhm.
in your department. So for me, it was my manager. And so
That's awesome.
the incentive really was if you were going to submit an abstract, then you were going to be at the conference if you were accepted, right? So maybe that's something that our radiation therapy community might want to explore, saying, okay, if you'd like to attend the conference, then you need to present, right? Or you need to
Mhm.
submit an abstract to get there. And I think that was really like really enticing, right? Okay, I know I want to go to the conference,
Right. A
so
motivator.
I could get over the fears of thing, but I think you need to have a strong leadership team
Mhm.
in order to get you there. And like how you mentioned for you, it was physics. I think we're trying to like flip the script a bit, right? And putting in
Yes.
our hands because a lot of times our profession, they aren't presenting as often as I think we should be.
Mhm.
And we're with the patients every day. And so I think we're the most knowledgeable in terms of how we could do things better to improve workflow efficiencies and how can we improve patient satisfaction. I know for us, when we started incorporating pre-treatment checklists and pre-simulation checklists, our Press Ganey surveys were so much better than before when we would just bring a patient in the treatment room, tell them what we're doing as we're doing it, and
Mhm.
then they'd be on their way. So like seeing those small victories turn into big victories was really eye-opening for us.
Oh, that's amazing. I absolutely love it. Those little scores. it means so much, to see those things improve with implementations of new programs and things. That's really amazing. And kudos to your manager for being a supportive pillar for you and pushing you forward in your desire to do more.
Yeah, for sure. I mean, I don't know that I would have been where I am today without having that support system. So it really, it means a lot um, when you have a manager who supports you in and actually professionally developing yourself, right? And not just
Yeah.
feeling stagnant in the day
Hmm.
to day of treating.
No, it's so important. It's so important, and I think overall reduces. As the very beginning of your presentation, it could reduce the burnout. It could increase job satisfaction to have participation in some of these more research based or educational type of functions within the clinic. I do recognize, however, the clinics are busy, and then it's hard to dedicate that time to it. And for a manager of a clinic who's maybe slightly understaffed or having a hard time, I don't know if you might have a few words of wisdom for those who are looking to open the doors to their staff members to be able to pursue some of these things.
Yeah, so what I would say is I think it's really important to be able to set aside time, whether it's bi-weekly or monthly, to, have a meeting with your team during, maybe you shut down the machine from 12 to 1 or something like that, to have that meeting and go over things like this, or just be able to offer them continuing education credits by attending a conference.
Mhm.
Sometimes just going to a continuing education presentation during your lunch break opens up the doors for something else. Maybe that sparks interest in presenting on something that you find interesting. So I think just being able to actually, I know it's hard, but implement time in the
Mhm.
schedule to offer the therapist some time to do something else, right? Besides just treating and that's it. So for me, in my experience as a leader, we would shut down the machine once a week from 12 to 1, or we would do a meeting with all the therapists on Fridays from 2 to 3, right? And so that's important, because otherwise you're never going to find time for anything
Mhm.
extracurricular if it's
Mhm.
just constant on the machines treating. So trying to find some avenue for managing the schedule a bit better.
Mhm.
Maybe you need to bring in a per diem for a day, right? 2 per diems to cover the machine so that you can get your regular staff involved in these things is important.
Yeah, it is. It's critical. I feel like there's so many opportunities that, if given just a small an hour a month, just a small amount of time, to open the doors for folks, increase job satisfaction and maintain staff and then maintain our field. I so appreciate your sentiments there. I wholeheartedly agree. And my next question is, where can we find your handbook? Where can we find a copy of your guide, your pocket guide?
Yes, so it's available on Amazon. So you just search Radiation Therapy Pocket Guide. And so my thought behind this whole process was, actually my daughter was telling me I need to publish her little books that she's been making. And one day it popped into my head. I'm like, gosh, this is a great idea. And it really came from my 7-year-old, honestly.
That's
But
awesome.
and then I thought of what was something that I felt I needed when I was a student. And so, my program director was always saying, you have to go into clinic with, a small notepad
Hmm.
and a pen so that you can take notes. And if you have questions that pop up. So I purposely developed it with the student in mind. So the back of the handbook is a place for notes and journal entry. And then the front is for medical abbreviations and common terms that they'll see in the clinic. So yes, you can go on Amazon, just search Radiation Therapy Pocket Guide, and it will come right up. I'm super proud of it, and it's been selling in Germany and Sweden and the U.S. So it's really exciting. I hope that clinical educators find the need to somehow incorporate it into their course content. And so, I think it will really be helpful for students. Actually, we have a therapy clinic who we're affiliated with at the college, who keeps it actually on hand at the treatment machine in case there's a word that comes up that maybe they're like, what is that?
What is
So
that?
yeah, it's not only technically for students. We can even refer to it as therapists. But I think the point behind making something like this is just to kind of show that like we can be the pioneers in our field to do things other than just treating patients every day, right? And so how can we improve and how can we develop ourselves to become the best that we can be?
I adore that so much. That's absolutely true. Thank you so much for the information. I will include a link to the Amazon page to find your book in the description notes of the show. So
Oh,
for
great.
those listening, check the description box of the episode here, and you'll find some information on how to find Angela's book. Such an amazing career path you've had so far, an inspiration to us all. Thank you so much for everything you do. We're so grateful.
Thank you so much, Tracy. And it's been a pleasure to be on the show.
Absolutely. The pleasure is all mine. I'm so excited for this episode to air. I know it's going to mean so much to not only our medical physics audience, but also the radiation therapists and the students out there looking to learn every day. I foresee pocket guides flying off the shelves.
Thank you so much. Thank you.
Of course. Folks, if you're still with us, we have had a blast talking with Angela Oliveira, Program Director and Chair of Radiologic Health Professions at Manhattan College, author of the Radiotherapy Pocket Guide, which again, check the description box and you'll find a link for more information on that. I'll include a link to Angela's Facebook, my goodness, LinkedIn page as well, so you can reach out with questions and learn more about the steps that it might take to either get into things like this yourself or to help your team do so. Angela, again, thank you so much.
Thank you.
A quick note for our listeners before we wrap up this episode. I would like to extend a sincere congratulations to Angela as she'll be embarking upon her PhD program this fall. Angela, so many amazing contributions to the field already and many more to come, I have no doubt. We'll be excitedly following your journey, so we wish you the very best in that effort. In addition to that, Angela will be presenting at the ASRT conference in Washington, D.C. this year and would love to connect with you if you're able to attend. So be on the lookout for her presentations, and we look forward to seeing you in D.C. Thanks again for listening. Have a wonderful day.